it feels like a big part of the trauma story, because it did even more damage to her.
Understand that they do have a scope of practice, and there are boundaries within that you can ask them questions.
Welcome to the Heal, Thrive, Dream podcast, where trauma survivors become healthy thrivers. Each month, we'll feature a theme in the trauma recovery and empowerment field. To promote your recovery, healing, and learning how to build dreams, here's your host, Karen Robinson, transformational coach and therapist.
Hi, welcome to the Heal, Thrive, Dream podcast. Today, I have a super amazing guest, and I can say that because I've talked to her for a few times now. I am interviewing Elizabeth Kipp today. Elizabeth is a stress management and historical trauma specialist who uses trauma-trained and yoga-informed addiction recovery coaching, ancestral clearing, compassionate inquiry, and yoga to help people with their healing. Elizabeth healed from over 40 years of chronic pain, anxiety, panic attacks, and addiction. She now guides others to unleash their healing power, find freedom from suffering, and live a thriving life. Elizabeth is a best-selling author of The Way Through Chronic Pain, Tools to Reclaim Your Healing Power. Elizabeth, welcome to the show.
Well, thank you so much, Karen. I appreciate that beautiful introduction, and it's great to see you.
Likewise. Anything to your bio that you would like to add? It's a great bio, by the way. It's very succinct and clear. Anything you want to add off the cuff?
I would like to say that I'm a guide to helping people unleash their healing power. That's like, especially in the trauma space, we are so protective, defending our safety or the best we can, that we're almost blocking our healing, right? Because we're contracted. So that's what anybody in the trauma space does. That's just the language that I use. We help guide people to unleash their own healing power.
Yeah, I think that word is beautiful. I recently changed my Facebook cover, or I'm holding this book, and I wrote, "This is me reading all the books, trying to find all the answers when they're already in me."
That's a good one.
And our healing is already in us. And I love the fact that you help facilitate people see that and experience it. I also love, like, recently we had a chat that both of us have never met or treated or worked with someone with addictions that did not have some sort of trauma. Can you say a little bit more about that?
Sure. I just refer back to Gabor Mate, who asked, don't ask why you didn't ask why the pain. Chronic pain, just for the audience, is any pain that's physical, mental, emotional, spiritual, financial, any pain that's felt 15 days for 3 months or more. So grief is a chronic pain experience. The brain can't tell the difference between a broken bone and a broken heart. So there's all kinds of things, our attachment wounds that we have, this need to be, when our needs don't get met as youngsters, that's disconnects us from our authentic self, because we'd rather be attached than authentic. It's not like we think about that as children, but we're going to go for attachment just for our own safety, for our survival, rather than our own authenticity. We're not going to put our authenticity, we'll put that to the side, right? And that creates a chronic pain situation, because we're denying our own true nature. I hope that made sense. Yeah. So
No, it does.
Yeah. So people that are in have addictive behaviors And nowadays, I mean, I think we all have some kind of addiction. When we think of addiction, it's not just drugs and alcohol. It's drugs, alcohol, um, technology, food, people. Um, there's another one.
That's
Yeah, well,
pornography.
people would be another one. Yeah, that's would fall into people, and and then there's like nation, self self doubt, uh, um, right, judgment. These kinds of things are that's super negative, and chronic pain, the the mind that more negative. We're already a little bit negative in normal, and a healthy brain, just to keep ourselves safe in the world. When something new comes in, our kind of first reaction is no, which is really a survival thing. But in chronic pain, the um, the mechanisms in the brain get changed, especially in the emotional part. We get brain fog, and we can't think straight. We can't remember what we just did. Like, where did I just put my keys? I know I put them somewhere. That kind of thing. But the emotional part gets changed so that we become much more negative. So it's all your fault. It's all my fault. The world is, there's all kinds of, the mind just comes in with all kinds of negativity, which is also, when you've got unresolved trauma in the system, it just feeds on itself. So those are anybody who's had chronic pain, which is somebody sitting with unresolved trauma, will recognize those symptoms. Yeah, it's what we have to deal with, that negative thinking. Mm-hmm.
Yeah. I'm really glad that you're talking so openly about emotional pain being part of the chronic pain cycle. Because a lot of survivors, I think they feel crazy when they, say how much pain they're in. When the
Mm-hmm.
doctor's like, no, there's nothing wrong with you. No, that's all mental health. Well, mental health impacts our physical health and spiritual health. It's all interconnected, right? So I'm really glad that I think it validates people who are really suffering. Of course, everything hurts.
Mm-hmm. Yeah, well, the integrated model, which is more and more Western doctors becoming integrated and recognizing you can't separate mind, body from spirit. The Eastern medical models all recognize that, but like Ayurveda and traditional Chinese medicine, they recognize that. But Western medicine's kind of just getting to that. So when I sit in front of a doctor, which I did for years, but I have the science background, so I had a little bit of an edge, just in terms of kind of understanding a little bit where they were coming from. And a doctor says to me, "It's all in your head." My answer to that is yes. That's where the brain processes pain.
Yes.
So they couldn't get away with that with me. And the other thing is, another way to look at someone who says that, because I think it's harmful. Remember, and I think when someone says it's all in your head, there's something wrong with you, those two things don't equate. If there is something that's a mental and there's nothing wrong with you, those two don't even make sense, that statement. Right? I mean, I'm not sure. I would say there's an imbalance. This right wrong thing is also a nomenclature that's difficult. It's really not. It's not clear, and it makes people feel like that they're wrong, and it brings shame into the thing, and that's not healing. So it's like there's an imbalance somewhere. We can't identify it. Would be more honest, really, or more accurate, and also, if I'm very clear about the lens that the doctor, the healer, doesn't matter, therapist, whatever, the lens they're looking because we all have a scope of practice, and we all have a perspective and an orientation. It's telling us about the limits of the model that they're working under. And so when I sit in front of any healer, and I think this is really important for people to understand, because I had to go through this transformation myself. First of all, I have to understand that they do have a scope of practice, and there are boundaries within that you can ask them questions within it, but don't ask them questions outside of that, right? Because they won't be able to answer it. So understanding that they have a scope of practice, and also, what are my expectations of that person that's in the healing space? Are my expectations in alignment with their scope of practice? So that I don't walk in as a patient who needs something or walk out not having my needs met because I had an expectation that's outside of their scope of practice. Yeah, this is important.
Very good point.
Yeah, so you can't go to an orthopedic doctor or a surgeon, an orthopedic surgeon, and ask them about nutrition, because they're not going to be able, and I have done that. They're not going to be able to, that's not in there. Literally, I have done that. And their answer.
Yeah, I've worked with a lot of doctors, professionally and personally, and it's really not a big part of their medical school training to begin with, anything about nutrition.
Yeah, exactly. But an orthopedic surgeon is going to cut, and he knows about the surgery and send you to a physical therapist to help you rehab from that. But he's not going to take you through that physical therapy. That rehab person will. You see? So everybody's got a scope of practice. Yeah.
Yes. Yeah, I think that's a great point. I think I don't know how to articulate this exactly, but my experience with my clients is like, they get poo-pooed by the doctor that, oh, there's nothing wrong with you. Or in the case of my mom, my perspective is, we don't know what's wrong with you. You're complaining of pain. Here's some opioids, and after 40 years of it feels like a big part of the trauma story, because it did even more damage to her medical and physical and mental health. Have you seen that a lot too in your practice? Survivors getting addicted to opioids or other meds?
Oh, sure. I help people. I'm not a therapist or a doctor that helps with detoxing, but I'm a great coach in that space because I've been through it.
Yeah.
And I was on opiates and benzodiazepines for 31 years. And it created, as you say, more than it solved. And here was the thing that was, again, I'm going to hark back to this thing about scope of practice, because it's so important. The doctors in my case, which is very similar to your mom, it's like they thought they knew what was wrong with me. I had an instability in my back. We had surgery on, but the pain never went away. And within their practice, they didn't understand why, but they didn't understand the nature of chronic pain, how to heal it. I had to actually find a doctor who specialized in that. So their answer was, here are your opiates and your benzodiazepines and anti-anxiety medicine, because you're not going to get better. They just made this assumption that I wasn't going to heal from chronic pain. So, and I remember when they gave me that prognosis, I was about 2 years into this problem and into the surgery for the 31 years of that medication. And they said, you're not going to get better, and this is the best we got. And I was very upset to hear that, and I didn't like that trajectory that they decided that I was going, because of my science background. I realized they were operating in this model of healing, and it has limits. And then the science, and that's within science, and science can only comment on that which it can observe, measure, and describe. But we live in the all that is, not just in the part that science can measure. And I knew I'd have to look outside of that if this was what medicine could give me. And I went all over, I tried things from all over the world to heal me. And I finally found a doctor who was integrated in Eastern and Western medicine models and really understood the brain and the way chronic pain operates in the brain. And so he brought in healing modalities to heal the changes that happen in the brain because of the chronic pain. And opiates and benzodiazepines do not heal those changes. So then we have suffering, and your mother suffered, and I suffered, and lots of people suffer. I think there's more doctors that are coming in nowadays that are integrated and understand this thing happening in the brain and how to shift that. But it's very sad how common it is. Yeah.
Yeah. And this isn't a great segue, but I definitely want us to focus on this in our short time together. Do you have a good segue on this, what we're talking about now, and transgenerational trauma?
Oh, sure. Well, that's great. Yeah. So some of the, it was interesting when I went into a pain management program to detox off the medication and to actually, see if I could reset my stress response, which is another thing that happens in chronic pain. Our stress response, which is supposed to kind of go on when we're stressed and then off when response gets stuck in the on position. So way and balance. So it's all the time. We're not built for that at all. It's very kind of corrosive to the mind, body, spirit system. And while I was there, one of the things one of the people that was there was John Newton, who was a wellness practitioner and an ancestral clearing practitioner, and he brought that in as a modality. And I learned, now I knew something about some of my family history, and I knew I was carrying the burden of, I just didn't know what to do with it. I knew I was carrying it, but I didn't know, like, nobody talked about it. And it was like, well, this is just my life kind of thing. And he brought this process in, and it was very helpful, and I could feel a lightening, and so did I could see everybody in the room. There were 20 people in this program, and everybody was getting relief from their pain as a result of this, which is interesting. Now, we don't say in ancestral clearing, we don't say we heal anything, but we do see results. Well, we see certain results, and I get really curious about that, and so I started looking into that from the kind of the science, and that's really an epigenetic change, which is an environmental change which is why we can heal. We're actually shifting the on-off switches within the DNA part of this. If you think about DNA in two ways, hardware and software, like in computers, the hardware is like, eye color, skin color, hair color, things like that. That they're kind of unchangeable, and everything else is the soft wiring. So the computer, itself is the hard wiring, but the software, the programs that you put into the computer, that's the software, and it depends on the computer's working in as to what programs are on it, and that's epigenetics. What's happening with the environment, how's the organism, person interacting with their environment. Well, those things get passed down. Those experiences get passed down both as benefits and as burdens. And so ancestral clearing, it's not the only one, but it's one way. Yoga can do this too. Helps us release the burdens of these old unresolved effects of intergenerational trauma in the system. Some examples, like a couple of examples would be like worry energy. I mean, we do have mirror neurons, and we tend to mirror people, as we grow up. But when my grandmother and my mother and my aunt and everyone kind of has this behavior, and then they tell us about their mother and grandmother, then you've got right. So we can
pattern here.
Yeah. So we come in with the energy, the frequency of the information that our lineage has been experiencing. And some of those, again, some of that is our gifts, like resiliency and disease resistance and things like that. And other things are burdens from unresolved trauma. So that's the connection. And those things can, because it provides, it kind of points us in a direction on a trajectory in life, the influences of those, that can create chronic pain by itself. If I have a fear of worry and I'm just worried all the time, well, actually called chronic stress, and that's a stress response stuck in the on position, and that's a nervous system that's now got a habit.
And it was wear and tear on your body to be hyper aroused like that all the time.
Yeah. So that's an example of how transgenerational trauma can end up in this time here. Just that thing right there. And we could sit here for another 30 minutes and I could roll off a bunch of other examples, but that's the answer to your question. Yeah.
And for those of you listening in the new year, January 2024, Elizabeth is a presenter at the Finding Freedom After Trauma Summit, and she's expert on transgenerational trauma healing, the ancestral clearing, and she's got all kinds of certification and coaching credentials. We'll be talking about that, so there will be a link to register below. And if it's after January, you can still get in contact with us to get the replay package so you can hear her training. But also, Elizabeth, if you could share your website and some of the things that you offer your clients so the guests listening know that they feel like a connection with you and how to get a hold of you too.
Sure. Thank you. Yes, you can all find me on my website, which is Elizabeth with a hyphen Kipp.com, Kipp, like Peter Pan.com. You have to put a hyphen between my first and last name. Otherwise, you'll get the web designer and photographer Elizabeth Kipp. So that's not me. So Elizabeth with a hyphen Kipp.com. I really, in the trauma healing space, as we talked about chronic pain, I'm really good at the chronic pain piece of it. I've been in that space for so long, 40 years of it. You can't kind of come to me with a block I haven't already seen or dealt with myself, like move through myself. So I'm really good at kind of spotting blocks and helping you to release that and kind of get past that. I'm great at that. I offer ancestral clearing, of course, helps you release the burdens of the past, whether it's in the lineage or in this lifetime. And I teach trauma-informed yoga as well. Well, I teach yoga. I can teach meditation of any kind, yoga of any kind, but I'm really in this space because of the chronic pain and the trauma. I really focus yoga, so I teach that as well. So you can book a session. You can book an introductory session with me for free, or you can book a 25 or 50-minute session. It's all up on the website. There's plenty of free resources on the website and lots of free information. I'll be glad to get in touch with you.
That's so awesome. And also, before we wrap up, I want you to talk about your book for a couple minutes too.
Sure.
So we can promote your book here a little bit.
Sure, thank you. So the Way Through Chronic Pain, Tools to Reclaim Your Healing Power, is actually a companion to the book Chronic Pain, An Innovative Mind-Body Approach by Dr. Peter Prescott, who was the doctor that took me. He was the one that detoxed me and really helped guide me into my own healing. He wrote a great book. He passed away in 2016, but he wrote this beautiful book. And it's a little more dirty, and he's got beautiful exercises at the end of the book that I have myself, so they're wonderful. And then I wrote this, which is more like the voice of a chronic pain sufferer, like what has happening inside of the head. So that doctors, nurses, healthcare practitioners, family members, and chronic pain sufferers can really understand kind of what's happening in the mind and And I don't think there's a book quite like this. It's not a very big book. It's a kind of a short book, but it speaks to that and the tools that we use to help shift the mind and the perspective on pain, so that we may still feel pain, but it doesn't freak us out so much. It's not like bad. It's just information in the system. But to get from pain is bad, I want to get rid of information in the system. What is it showing me? What is it trying to teach me? That takes work. And that book shows that. Yeah. So in chronic pain, we don't tell the truth.
Yeah.
We're either quiet and we don't say anything, or we complain all the time. And neither one of those is the truth. So
I know people both of those ways in my family.
And I've been both of those people.
I am both of those people.
So this is anyway. So that's about my book. Yeah.
Oh, thank you. I have not read it yet. I would love to do that. It looks really powerful.
We have I just want to mention we have it's in paperback, and it's now under projection Audible. So I'm really excited. That'll be coming out this year. Probably in the first half of the year we'll have that out. Excited. So thanks.
That's so awesome. Oh, I also wanted to mention too, like how I met you is Laura DeFranco is a healing writing publisher. I'm sure I did that the best way, but she introduced us. And I noticed that you're part of her writing circle and you're doing a training for writers. Could you just say a couple things about that? Yeah.
Sure. Yeah. It's actually a journaling for trauma recovery is the segment I'm teaching. It's so exciting to me to be able to bring this in, because writing for me has allowed me to hear parts of me that I didn't even know were in there. It's this beautifully healing space. And what I like to bring to the table is, because people can be very nervous about writing, is kind of ways to calm and ease, find calm and ease in the writing space and relaxation, so that you can just let kind of things flow. And so that segment in the writer's circle will be journaling for trauma recovery, will be about, how do you find a safe place within the writing world so that you write whatever's on your heart.
I was sold when I saw that. I'm actually joining the circle today. I tried the other day and there was a little weird thing with the link, so I'm going to do it again today. I want to come to your thing, but I'm going to be traveling to the replay. Okay. But it's awesome. I was I can't tell you how excited I was. Like, all my love is all the things I love, and when teaching. So not all the things, but you know what I'm saying. I was excited. Yeah. I do believe journaling is extremely healing. I love how it taps into our subconscious, and like we find all kinds of surprises that can be healing when we do that. So that's beautiful. Yeah, and a plug out for Laura DeFranco, because she's a gold sponsor of the summit that we're doing. So I'm super appreciative of her work and her helping survivors have a voice through writing.
Yeah,
that's really
Brave Healer Productions. She's got a beautiful community.
Brave Healer Productions.
Yeah.
Yes. Brave Healer Productions. Thank you for saying that. I was spacing out a little bit today. Not enough coffee yet.
No worries.
Hey, and any final words of wisdom? Go ahead.
Well, I'd like to say that I want people to, one thing I'd like you to remember from this podcast is that the greatest healer lives within you. Doctors, therapists, coaches, all of us, we can guide you and point you to the kind of what are the optimal, what are the things that can help you optimize your healing. But the healing that wisdom is inside of you. It's not in the doctor or the therapist. So make sure that we kind of remember that, so that we're oriented in the right direction. And so that we begin then to, that helped me be really tap into my self-care and kind of understand, oh, it's happened here. It's not after that, right? Which is another thing we do in addiction and chronic pain. We're reaching out there and it's in here. So that would be the thing I want people to remember the most.
Yeah. But I think for some people, not everyone, to connect that to knowing that that's your higher power knowing lives within you. And so, like, once I learned that, or I think I've always known it to some sense, because I was born like this little old lady when I was a baby. I was always an old lady. So I think I've always known, but when I knew, that was life changing too. It's like, oh, I don't have to search and search and search. It's all here. I just have to be quiet.
That's
Which
right.
is the hardest thing in the world when you're a survivor, and the anxiety and the hyper arousal is going. But learning to be quiet, and so that's why that yoga and the meditation work and the energy work is so important, to get quiet.
That's right.
All there.
Yeah, that's why I bring in a breath meditation practice, 3 different little breath practices for people to help them, regulate, calm the nervous system, and for the stomach. So, and I love teaching that because it's so effective.
Yeah, we are very fortunate and blessed that you're coming to speak. So thank you.
Thank you.
Yeah. All right. Well, thanks, Elizabeth, for being on our show today. We appreciate having you so much. It was a beautiful discussion.
Well, thank you, Karen. It's always great to see you, and I'm so grateful that you have this platform.
Thank you for listening in today. Please join us next week, same day and time. Also, I would love for you to check out my website, healthrivedream.com.